The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Welcome back to the next episode. So excited to be here. I have a very special guest, Denise McNulty. And Denise, welcome to the podcast.
Thank you for having me.
Of
I'm very
course.
excited to be part of this.
I'm excited to have you here, and so are the Shifties. So typically what we do is we have our guests do an introduction. So Denise, please give yourself a nice introduction.
Okay, I'm Denise McNulty. I consider myself a nurse first and foremost. I've been a nurse for a long time, and the career that nursing has led me on has been amazing. From patient care to cardiac rehab to nursing professional development, and being able to fight for the mental and behavioral health of our nurses in the current complex healthcare environment.
I love it. So tell us a little bit, tell us about your clinical background.
I started in med-surg, and at the time that I started, most people started in med-surg. Med-surg nurse, I had a time in critical care, then post-trauma. Then I went to post-anesthesia care, then ER nursing. And then I was able to combine my love of physical exercise and training with cardiology. And I worked for 11 years in cardiac rehab, one of the most rewarding periods of my life, taking somebody after a traumatic event they figured they no longer knew who they were. Thought they couldn't get back to where they were, and taking them past where they were before they had their event and helping them become more healthy and promoting their health. It was a wonderful journey.
Yes. And it sounds like I started off my career as a med-surg nurse as well. And it sounds like you've had a lot of different shifts. That's why we call the podcast The Shift in your career. So how long? I've been a nurse for 31 years. How about you?
I really want to say that I've been a nurse for 42 years.
Wow. Congratulations. Thank you for all of your hard work. It's awesome.
It's been wonderful. It's been a wonderful experience.
Yes. So, Denise, you and I had some conversations offline, and we were just kind of talking about shifts and leadership and the nursing profession. And you mentioned something about your leadership journey, and it wasn't going the way that you had hoped or anticipated. Can you talk a little bit about that leadership journey?
Yeah, I had started out in nursing, and in cardiac rehab, I got a chance to lead. And I had a fantastic mentor, Fred, who role modeled for me what nursing was and what nursing leadership was. And I thought I was well on my way. And then I moved from Long Island down to Houston, and I got a job, and things just weren't progressing. And I didn't understand why. And then through a bunch of twists and turns, through studying resilience, I landed upon emotional intelligence as something that was a big better indicator of your success than his IQ. And as I looked into it, I realized that was my answer. My answer was to become more self-aware, more aware of what my face did when I thought, more aware of who was in front of me speaking, just more aware of everything going on, my emotions, how they impacted me, then being able to manage those emotions as information, and then being able to work with the people and notice what's going on with the people around me and be able to manage my relationships better.
So let me ask you this, Denise. When we talk about emotional intelligence, and you said things weren't going as, and these are my words, not yours, they weren't going as you had anticipated. Did you receive feedback along the way? Because feedback is always a gift. Did you receive feedback along the way in your leadership journey that maybe you had opportunity to hone your skills on emotional intelligence and social awareness?
Um, yes, the feedback that I received was very hard to take, but like you said, it's always a gift. It gets you moving in the right direction. And the feedback was that my face told every thought I had in my mind. That if I was frustrated, it showed. If I thought somebody said something that I didn't agree with, it showed. Everything showed on my face, and that it was a detriment to my career.
Wow. Denise, first of all, I want to thank you for being so vulnerable because I have received a lot of feedback in my 31 years of nursing. And I'm so grateful for the people that were able to really sit down, and I call it a courageous conversation, because it really takes courage to tell someone that there's things you need to work on. And it's really up to you, the person receiving the feedback, of what you're going to do with it. You can take it as a personal attack, or you can take it as, oh my gosh, this is an opportunity for me to make a shift. And it sounds like you took it as an opportunity to make a shift.
I did. I took it as an opportunity to make a shift. And if I were to name that shift of where here was my starting point was leading is making things happen through other people. That sounds good until you realize that leadership is being able to form the relationships to create influence, to transform or make incremental changes to improve outcomes and the workplace. And that shift came through emotional intelligence. And my emotional intelligence was honed with mindfulness.
So give the shifties a couple examples of how you really honed your emotional intelligence, because I think a lot of people listening, there's always opportunity for any type of growth and development. So what are some tips? What did you learn along the way?
Learned along the way. What I learned along the way was that you can't get anywhere really with talking. You need to listen. And taking somebody who is a creative thinker, as myself, I think all the time and I want to share, but learning when and who to share with
Oh, that's
through
another good one.
listening and being able to sit and listen. And when you were talking about feedback, I I learned to use my emotions as a guide to make better decisions. So when you get feedback, it doesn't feel good sometimes, and I would find myself getting angry or feeling put upon. And as soon as I got that feeling, and that feeling would be in my gut would start to roll, kind of. It's a feeling. And because your emotions always have a feeling with them, that's why we call them feelings, right? So that rolling. And as soon as that rolling would start, I would take a deep breath and say, listen, you can learn something. Listen, you can learn something. It was my internal dialogue instead of paying attention to and letting the emotions take control. It was a way to use that as information. Okay, this doesn't feel good. There's probably truth in it. Listen. And if I would think of a third thing, that it's reflection.
Mm-hmm.
Reflection. When things go well, why did this one go so well? When things don't go so well, what could have been done differently? What did you let your emotions get in the way? Did fear take over? I'm listening to a new book right now. Oh my gosh, I can't think of the name of it. It's new by Brene Brown, and she talks about being below the line, and that line is being in fear but not realizing you're afraid, and that's when you make your mistakes. So,
Yes.
knowing when you're in fear and using that fear to say, okay, I need to take pause, or I can use this information to make better decisions and listen. whenever the emotions go, listen, listen, listen.
And I think it's so important to be, to your point, self-aware of your emotions. And I always say this, I have two children. My son's 21, my daughter's 20. And often when he's delivered good, bad, whatever the news is, he's very much aware of his emotions, and he responds in a way that's very calm because he's so aware of his emotions. So he responds with intellect. And my daughter, who's not as self-aware, she responds with emotion. And sometimes when you respond to emotion, your verbal and nonverbal come across in not the most positive light. And I think you learn those skills with maturity and life experiences.
Yes. That's probably the biggest shift with emotional intelligence and mindfulness for me, was going from emotionally reactive to intentionally responding.
Yes. And it is hard work. And I'll be
It
really
is.
transparent. I work on that. I still have to work on my EQ. And I think we all do.
We do. It's learnable, but it's not an 8. Some people, I guess it is an 8 for, but other people have to work a little harder at it. And I do find that if I were to find my one law that I have to watch for the most, it's patience
Ooh,
and get
that's
impatient. And I have to work on that daily. And my reflections are, okay, how could I have been more patient, especially when I'm behind the wheel? Oh, unfortunately, behind the wheel, the worst person comes out of me. And I'm working on that.
yes, I think a lot of people are work on that as well. When we think about the components of emotional intelligence, like self-awareness and self-regulation and motivation and empathy and social skills, how do you think you did in the empathy department?
I wasn't very good. That was a hard journey as well. And putting myself in other people's shoes, I guess I was okay with the empathy, but it was the compassion that was harder. Putting yourself in somebody's shoes, okay, understanding where they were. I've been there. I understand. Let me sit here with you. That's hard. I know how hard that is, whatever that empathy is. But then the difference between empathy and compassion is the action component, the desire to help. So, trying to fix things for people isn't help. That
And
was the thing I had to learn, to go from being empathetic to being an empathetic, compassionate person, knowing when listening is the help that's needed, knowing when to offer something and when not to offer something, and to provide direction, not necessarily direction. Now, what I mean by that, offering pathways instead of one steadfast direction to take. When they say you're raising kids, give them a choice. Well, as people go through life, they still want a choice. They don't like to be told what to do. They like a little guidance in a direction, a little map, but they determine where the destination is, right?
and those are a lot of the principles of humble inquiries. People, to your point, they don't like, especially as adults, they don't like to be told what to do. It's more empowering to ask people. And then when you ask, you can listen, you can really empower possibilities, and you really meet people where they are. And I think, when you're leading 20, 30, 100 people, it is hard to have to set aside all that time to really genuinely listen. Once you master that, it really makes your world a lot easier, and it's better for building relationships. And this, I'm strictly going from my experience, and I assure you, I am not perfect at it. I'm not perfect at it. I can truly there's always room for professional growth and development as it relates to emotional intelligence, because we're all going to misstep.
It's human nature, you
And
know?
what's powerful, honestly, Denise, is when you have people on your team, people on your side, that they will courageously tell you when you misstepped, and then they will help course correct.
That's the best type of person to have on your team. The person who helps people course correct, the person that knows how to deliver information in a way that is not criticism, but it's providing direction or options for directions. And listening is the key, as I think I've said that many times. And I still, listen to respond sometimes instead
Yes.
of being in the moment and mindful right now, not listening to you to respond, but listening to you to have a meaningful conversation. And even right now, I'm working on that as we speak.
Well, I'm sitting here thinking the same thing, because often we're not listening to understand. We are listening to figure out what we are going to say next.
Mm-hmm.
And that is really hard to shift that thought process and that mindset. The other thing, when we were talking about listening, I had a really dear friend who said to me probably 15 years ago, I was an interim nurse manager. And it was the first time I was leading a group of about 85 people. It was only for 6 months. And it was a short-term interim leader role. And someone said to me, who was a friend of mine, she said, Andrea, people are talking to you, and you can tell by looking at you that you're not listening. You're thinking about what you're going to do next, what you're going to say next. You're formulating this big list of accomplishments. Be in the moment. And some of the things that you think you have to check off the list, those are way, way at the bottom of the list. And so a lot of it's about prioritizing your time and where you're going to waste your energy and where you're going to conserve your energy.
That's a big decision. It's not an easy decision to make. There are a lot of things to think about within that. But if you truly listen, you might get the guidance you need.
And you have to be willing to listen.
It's so underrated, but so hard to do.
It is. So do you have an example? Do you have like a huge success story that you can share with the shifties? Because we always love success stories on the podcast.
When I was young, I got a master's degree in health service administration. And only about 10 years ago, I decided to go back to school and get a master's in nursing education. And that lit a fire in me for evidence-based practice and transforming nursing practice. And so I went on to get my DNP after that. But in the middle of all of it, I did some good work with mindfulness. I did some good studies on nursing professional development. We did a evidence-based practice on case study debate, enhancing critical thinking. And through all that work, I noticed the stress that we were under and started working on promoting the mental and behavioral health of nurses through lectures on resilience, then emotional intelligence, then mindfulness, then attention training. And the people I work with noticed all the good work I was doing, and I was nominated for a national award. So in July of 22, I received the American Nurses Association's Foundations of Nursing Practice Award. And I share that not necessarily to brag, but to let the audience know that once you get passionate about something and you have the right connections by joining your professional organizations and things like that, you can make change. I was interviewed by somebody from the American Association, the Organization of Nurse Leaders, and had information that was, and through that information that I shared, that was shared in DC to protect the mental and behavioral health of our nurses and clinicians. So you can make a difference and you can make an impact just with your passion and joining professional organizations. And as nurses, I really promote joining your professional organizations and being active. And who knows, you may make a difference that you're proud of and that you can stand on.
I'm glad you said that, Denise, because part of the shift is that we want to elevate the profession of nursing. So that's a really powerful message. The value of the community of a professional organization. You can never underestimate that value. And, Denise, we typically end the Shift podcast with one lesson learned that you want to share with the Shifties.
Listen and silent are spelled with the same letters. I don't think that's by mistake. In order to truly hear, you have to be silent in your words, your actions, and your thoughts.
I never even knew that. So that is truly a lesson learned. Thank you for sharing that. That is amazing. Well, Denise, I really want to thank you for you and I connecting, corresponding back and forth. I want to thank you for all your great work in the nursing space. And thank you for being on the podcast.
Well, thank you for having me. This was a blast.
I'm glad it was a blast. And Shifties, remember, your shift makes a difference. So keep shifting. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.